Episode 56 BG. Continuation of article about upcoming EU vote on biomass burning subsidies. But regrowth is not certain, and regrowth takes time, many decades or longer. In the meantime, burning wood makes climate change worse. The result? The citizens of the EU and UK are paying for their governments to claim that they are reducing emissions, while actually making climate change worse. Eliminating primary woody biomass from subsidies, as recommended by the European Parliament, could help avoid some of its most perverse climate effects. But even burning thinnings and forest residues puts more CO2 into the air per kilowatt-hour generated than fossil fuels. The first impact of wood bioenergy, whether from whole trees or residues, is an increase in atmospheric CO2, accelerating climate change, even if the wood displaces coal, a critical step backwards that will not be reversed for decades or longer, time we do not have, to meet the Paris commitments and avoid the worst harms from climate change. The science has repeatedly been shared with EU policymakers. In January 2018, when the EU was first reassessing the Renewable Energy Directive, 772 scientists wrote a letter to MEPs making these points. In September 2019, the European Academy's Science Advisory Council, ESAC, which includes all the national science academies of EU countries whose environment program is headed by one of the present authors, published a paper arguing that serious mismatches continue between science and policy in forest bioenergy. Since 2018, there have been 3 further letters from hundreds of scientists, including a former vice chair of the IPCC, pointing out the dangers of wood bioenergy to the climate and to biodiversity, concluded that only the burning of small twigs and branches would be better for the climate over a 10-year period than continuing to burn fossil fuels. All other feedstocks taken from forests are much worse. Ceasing all subsidies for forest biomass, whatever its source, is urgent. Should they prevail, EU countries will continue to spend their renewable energy subsidies on a technology that adds CO2 to the atmosphere and accelerates global warming and the damage it causes. We need meaningful action now. Adopting the Parliament's case to remove primary woody energy from the EU's Renewable Energy Directive would be a good start. Asia. Bangladesh. Air pollution causes 20% of premature deaths in Bangladesh, says World Bank study. BD News 24.com. Large factories and transportation will only see partial success in reducing PM2.5 concentrations across the region. China. The spatial spillover effect of higher SO2 emission tax rates on PM2.5 concentration in China. Nature. Although the PM2.5 in the atmosphere of China has declined steadily and significantly in recent years, but the average atmospheric concentration, chemical fingerprints and source profiles of PM10 and PM2.5 from agricultural soil in aerosol and air quality research papers on PM2.5. Wood smoke is 90% PM2.5. A dusty day in northeastern China. NASA Earth Observatory. Quality sensors measured soaring levels of particulate matter, PM10 particles and above 200 for fine, PM2.5 particles on that day. India, Bengaluru. New study shows Bengaluru air far worse than reported by KSPCB, Deccan Herald. 2 of these stations do not monitor PM2.5, the fine particles that can enter the bloodstream through lungs and cause several diseases. Laos. Laotians warned as air pollution hits danger level, the Manila Times. The concentration of fine dust, known as PM2.5, which is particulate matter with a diameter of less than 2.5 micrometers, has surpassed the research on PM2.5 and blood lipids. Wood smoke is 90% PM2.5. ROS-UP view, low-density lipoprotein, LDL, Cholesterol is considered bad cholesterol, in terms of human health generally. PM2.5 raises LDL blood lipid. New study investigates effect of short-term PM2.5 exposure on blood lipids. News Medical. PM2.5 was positively correlated with low-density lipoprotein, cholesterol level, and total cholesterol concentration, and negatively correlated with PM2.5 and cardiovascular events. Fine particulate air pollution exposure linked to risk of cardiovascular events. Pulmonology advisor. Investigators therefore conducted a retrospective cohort study to quantify the association of long-term PM2.5 with incident AMI, IHD mortality, and PM2.5 and the intersection of race and class. Marginalized groups may benefit more from decreasing air pollution. MedPage Today. Marginalized groups appeared to benefit more from decreasing levels of PM2.5, fine particulate matter less than 2.5 microns in diameter. Air pollution and mortality at the intersection of race and social class, NEJM. New England Journal of Medicine. Lower PM2.5 exposure was associated with lower mortality in the full population, but marginalized subpopulations appeared to benefit more as PM2.5. The Racism of Virtual Pollution, Science 2.0. Particulate matter 10 microns in size hover in the air. The famous PM2.5 was suddenly the new goalpost, they said, and showed air quality maps.